When a child has a primary immunodeficiency disease, PIDD, their body struggles to fight off germs that cause illness, leading to frequent infections in the ears, lungs, skin, and other areas. PIDD can occur in babies, young children, or even adults, with over 200 different types affecting various parts of the immune system. This makes it more likely for individuals with PIDD to become sick from infections. Each person's experience with PIDD is different. With proper management, children with PIDD can still attend school and make friends, while adults can lead active, normal lives. Mild cases of PIDD may require medication to treat infections, while more severe cases may need antibody therapy through treatment or even a bone marrow transplant. Although it may be overwhelming to learn that your child has PIDD, there are various treatments available to manage symptoms and help them stay healthy and active. It's important to seek emotional support from family and friends and connect with other families facing similar challenges. PIDDs, or primary immunodeficiency disorders, are not contagious like a cold or the flu. It is a genetic condition that affects the immune system, which means your child is born with a gene that doesn't work properly. In some cases, PIDDs can run in families, but it can also occur randomly. Typically, white blood cells in the body are responsible for fighting off infections. However, individuals with PIDDs may have a deficiency in certain types of white blood cells, or these cells may not function effectively. As a result, they are more susceptible to infections that would not affect others. As a parent, you may not notice any symptoms of primary immunodeficiency disease, PIDD, in your child until they are a few months old. Your child may experience frequent and serious infections, such as recurring ear, lung, skin, eye, mouth, or genital infections. They may also require antibiotics through and for infections and may have difficulty recovering from illnesses, such as pneumonia or bronchitis. Additionally, if your child experiences thrush, a fungal infection in the mouth, that doesn't go away, antibiotics don't work well, or they get pneumonia more than once a year, these could be signs of PIDD. As part of the diagnosis process, your doctor will conduct a physical examination and may ask you questions such as: has your child experienced frequent and severe infections? If so, how long do these infections typically last? Does your child continue to be sick even after taking antibiotics? Do other members of your family also experience frequent illnesses? In addition to the physical exam and questions, your doctor may also recommend blood tests for your child. These tests will analyze the blood to count the number of white blood cells and measure certain disease-fighting proteins called immunoglobulins. In some states, newborns are now tested for the most severe form of primary immunodeficiency, called SCID, severe combined immunodeficiency. What other factors could lead to these symptoms? What can I do to prevent my child from getting sick? What kind of side effects should I anticipate from the treatment? Are all the regular vaccines necessary for my child? Are there any specific sports activities my child should avoid? Your child may need higher doses of infection-fighting medications and may have to take them for a longer time. In serious cases, they may need antibiotics through and for. Your doctor might also suggest treatments to help your child's immune system work better. Immunoglobulin, Ig, replacement therapy, which are disease-fighting proteins called antibodies that your child needs. This is usually given through a needle or by and may cause some side effects like achy muscles, headaches, or a low fever. Stem cell transplant, which is rare but can be a cure for very severe PIDD. This involves getting new stem cells through and for, and can take 2 to 6 weeks for the new stem cells to start making healthy blood cells. During this time, your child may need to stay in the hospital or have daily visits with their transplant team. It can take 6 months to a year until the number of good blood cells in their body gets back to normal. It's important for children with PIDD to still be able to go to school, make friends, and participate in activities. Meeting with their teachers to explain their condition and letting the school know about any medications they may need to take is crucial. Just like anyone else, it's important for children with PIDD to eat healthy, exercise regularly, and get plenty of sleep. Washing hands frequently with soap for at least 20 seconds and using hand sanitizer when necessary can help keep germs away. It's also important to help children with PIDD manage their stress levels. Encouraging them to relax, play, enjoy hobbies, and spend time with people they like can help lower their stress and support their overall well-being. Each person's experience with a primary immunodeficiency disease, PIDD, is unique because there are numerous types of this condition. With the appropriate treatment, most individuals can lead a fulfilling and active life. In severe cases, stem cell transplants may be used to treat and potentially cure the disease, although this is a complex procedure. If your child is affected by PIDD, it's important for the entire family to receive emotional support from friends, extended family, and neighbors. Speaking with your doctor about connecting with other families who have a child with severe PIDD can provide understanding and support. If you're looking for a doctor or support group, the Immune Deficiency Foundation's website can help you out. They also provide information about clinical trials, which test new drugs to see if they're safe and effective. It's a way for people to try medicines that aren't widely available. It's best to consult with your doctor to see if this is a good option for your child.